you do something and it doesn't work, how do you actually manage that internally? We're all, we're all proud. We all have egos. We all want to be good at what we do. We all want to get good outcomes. So that can be a difficult thing, I think, when it doesn't work out how you want it to work out, or they wanted it to work out. So how you manage that, I think, is a lot of being very open, having those conversations.
The other thing I think too about the importance of setting up safe to fail experiments is your ability to be innovative or creative in tailoring solutions to an individual.
And I think this is one of the best things about our profession, particularly in an environment like this, a private practice environment. And I know that we brought this up with a couple of the surgeons as well. Like, surgeons seem to have that want to be innovative. And I think it's one of the most fun parts of our role is that the knowledge is expanding, the evidence is growing, and there seems to be more ability to actually explore things and try things and innovate.
And particularly in an open environment where, we don't have the luxury of being able to control all the things that we want to. And so more often than not, you're going to be applying multiple interventions at once, and not to mention things that we've talked about with considering other non-physical or systemic factors that you associate with someone's presentation, and thinking about, well, how do I actually configure this stimulus and this stimulus and this stimulus to see the emerging pattern that I want for that individual. And this is where I think it's actually, you always need to go in with an open mind when someone presents with a particular problem, because you actually don't know how that individual is going to respond. I mean, you have obviously indications, and if you've worked with that person for a long period of time...
This is such a good point, Jack, because I think this is one of the things that I struggled with the most as a younger clinician.
Yeah.
Was the amount of uncertainty that you keep being presented with, right? Like, as I said, we all want to get good outcomes. So you would love to be able to say, if I do this, I'm going to get this outcome. And we've spoken about it so many times about complex systems and biological systems, and how that's not what you get. A plus B does not always equal C.
Yeah.
Often it doesn't equal any of those, it equals 7. And you're like, well, how does that work?
Well, and this I think becomes more obvious with types of presentations where the timeline is larger, because you see the more significant difference of, if it's a short-term injury, 1 day or 3 days, it's not that big difference. But say post-ACL reconstruction is a great example of, the average idea is 12 months, but
it varies.
You've seen people that get back as close as probably 6 months to 18 months.
Yes.
It's quite significant. And I always find that interesting. There's a young girl I've been working with who ruptured her ACL, had reconstructive surgery. And when the first time I saw her physical capacity to begin with is just unbelievable in terms of positive, in terms of, not the typical restrictions in range of movement, able to produce force through large ranges of movement. And it was so unexpected to what you typically see. And it's like, well, what is it about this individual that allowed her to have that response? But again, the thing I'm trying to highlight here is it didn't meet my expectations. What was I going to focus initially on restoring end range extension? Well, she's done that.
Yeah,
we don't need to worry about that.
Yeah,
she was at a much further or progressive stage than what I would typically expect. But it's interesting because again, if we could follow a certain protocol, which would be like, well, I need
we're
to
doing
focus
range
on
at this
these.
point. Yeah,
exactly. But where is she based on what I identify as being the deficits, and what are the things that I need to actually do to apply enough stimulus to see that change?
and I think that's the thing that, like, there's been a number of different papers come out on